Thank you.
Hi, good evening, everyone. Thank you for that introduction, Samiksha.
Thank
And
you.
really appreciate the way you've brought it across. So I'm just going to start sharing my screen. Can everyone see it? Samiksha, can you see it?
Yes, sir.
Okay, perfect. Okay, welcome. I'm deeply honored here to be able to give this time, and I'm really privileged to be able to be given this time by you all. So I'm thanking you here for that. Now, coming to the topic. So my name is Ashraf Zohair. I'm a primary care pharmacist. I'm working, as Samiksha said, at a world-class company called Costco Wholesale and the pharmacy department there. I also am involved in performing some professional services for other pharmacies as a consultant in my spare time. I do that for the sake of their patients, and it is based on appointment-based sessions. That I do it through my appointment-based sessions. That I do it through my consultancy firm called RX Clinics, and I am deeply engaged in patient care via that platform. I'd like to also thank Dr. Karthik to be able to give this opportunity to collaborate with him and give back this experience to my home country pharmacists. So without any further delay, I'm just going to be talking about today's topics, how we are going to be going ahead and doing this. Um, Today's topics are going to be predominantly, I'm going to talk about the background of why we are talking so much about Canada. The topic here is career in Canada, right? And we are also going to be talking about how we are going to be preparing for Canada. And we are also going to be talking about how we plan to prepare for Canada, how to implement it, and how to personalize it based on our goals. Okay, so let's start with the background. Canada, an amazing country with lots to do. A lot of people want to come here. It's been a land of immigrants since the 16th century. Annually, Canada attracts close to 3 lakh new immigrants. Alone in the pandemic year in 2020, an approximate 285,000 immigrants were welcomed to Canada. About 110,000 immigrants were granted citizenship of Canada in the year 2020. Roughly about 21 to 22% of Canadian population are immigrants. And it is estimated that about 1.2 million immigration visas are to be granted by the year 2023. So now it comes for me, this is, why do I have this? This is all statistics, right? And this is all information that has been done through, this information has been brought to you by credible Canadian government resources. So this is not something I just pulled off from my head. It is all relevant on the websites, on the internet. So what is it for everyone? There are a few ways to achieve this goal of immigrating to Canada. Why do everyone want to be here? What is the reason why everybody is, or whoever is attending at least here, is interested in Canada? There's a few reasons for this. I've listed them out here. I'm not an immigration consultant, so I'm not going to be talking about a lot about that, but it's here for you to look at. This is the reason why you are interested. All of this, once you get your immigration or once you arrive to Canada, even as a student, you will be exposed in some way or the other for all of these points that I've listed out here. The one thing that it may not be given to you by just coming to Canada is the last point here that I have, which is the high quality of life. this is something that we need to be taking care of a bit at our end. Why I say that? Because the first point here does say is fair immigration, which is true. It is fair. However, it depends on how you end up using this opportunity for your benefit. It is fair in the sense they do recognize that you are eligible or suitable to be able to come to Canada. However, what you do after coming here is not their responsibility. It is the individual's responsibility, right? So you can be whatever you can. There's nobody stopping you from doing whatever you can. But if your goal is to be doing what your education has provided you in the last 4 to 6 years, then your goal here is supposed to be doing something as a career, not as just making ends meet. So this is what the topic is, right? Career in Canada. So why are we talking about career in Canada? Because today I'm not going to be talking about immigration. So let's just move on to us as pharmacists, right? People that are at the crossroads here, whoever is finishing their degree, whoever has finished their degree, or whoever are beginning their degree, all of them have different levels of thoughts. They have questions and they need to get answers, right? These are the things that is going on in everyone's mind, I think. Today's audience are mainly Pharm.D students that I can imagine. They are at their crossroads from their student's life to a professional life. They've been a student for the last X number of years. They are planning their professional life for the next set of decades. We're about to pursue this move. We're about to have this change from student to professional life is everyone's thought. Some of them want to do that in their country of birth, like their home country. Some of them want to go to places out in the Oceania region, which is Australia. Some of them want to go to the Middle East. Some of them want to go to the West, which is the UK, the Canada, and the US. Lots going on, right? Lots of thoughts. But for which I think the best answer would be an individual and customized answer for everyone. So for that, you need to ask your question for yourself, to yourself. Where do you want to be in 5 years' time from now? Right? Because reaching Canada, which is the topic today, merely is just the beginning of this journey. There's a lot of tremendous changes that one is going to be surrounded by. Social changes, mental changes, financial changes, in a way, professional aptitude. You may not have had that aptitude, or you may have had the aptitude professionally, but applying that aptitude is where really we are trying to focus on here. And then some of the who are later in their lives are considering this move have to also consider their health background. Sometimes they are at an age wherein they need to take care of their health as well while they are pursuing this dream. So these are some of the parameters. These are some of the challenges. And trust me, not everyone who reaches Canada is successful. It is not a pill for success just to land here. No. As I said, it is the beginning of this journey. So I would say, what is the reason why some are not successful and some are? I think it's because there's a lack of direction. There's a lack of focus. So if there's no direction, obviously the focus is going to be distracted. And what does it take to remain focused and not lose direction? I think it's the individual himself. Get the right information, right? Ask the questions that are needed. Do not ask those questions from the people who are not authorized to answer, like myself. I'm not authorized to answer those questions. I'm just trying to get information from the right sources and trying to provide that for people who are having access to the internet and they can go and get that information from so many places. So I don't ask you to trust me in blindly. Do your part and work towards it. For example, the information that I got about the immigration status is from the immigration Kenyan immigration government's website. I did not go and ask a person who has come to Canada with me as an immigrant. Similarly, you are supposed to be doing the same thing. Start pondering about how do you want to achieve this? What are your backgrounds? What is that you're able to do, and what is that you're not able to do? And the other thing I'd like to add here is I'm not saying I'm stereotyping this, but it is, I have seen this very common. Try to be resourceful, okay? Resourceful not just for yourself, but for others. Help each other. We are all in this race. However, all of us, we are all in this race, right? But everybody doesn't realize that we are not competing with each other. If we are competing, we are competing for a common goal. So competitiveness is good, but not to a point wherein you are hindering somebody else from getting this dream to be a reality. Right? So all of us here will get what is in your destiny. Definitely you will get it. But the way you reach your destiny by being resourceful to others, trust me, it'll help you first, because you will get that information because you are thinking not just for yourself, but also you're just thinking about what is right for yourself. And that rightness is what is going to help you be resourceful, not to others, but to yourself in the beginning. So I'm just going to talk about these white coat professionals that we are supposed to be known as, right? Ask yourself, who are we within the healthcare profession? You wore a white coat throughout your academic life, in the labs, at your institutions. But what's different from other white coaters, like the doctors, right? You need to differentiate yourself from them. If you don't differentiate yourself from them, how would you know your value? What is your role in the health professionals pyramid? There are so many, mainstream pharmacy education routes from where I come. I come from India, right? And pharmacy practice in most institutions and organizations in India are unable to define roles for the levels of mainstream pharmacy education that we have. Like, we start with a diploma in pharmacy, we go to a bachelor of pharmacy, master of pharmacy, now more recently doctor of pharmacy, and some of them even pursue a PhD in pharmacy. Although there has been some level of definition or attention given to the role that these mainstream pharmacy education levels give, I think still there's much more left to be done. Because if the attention was given, then the state of the profession is not going to be where it is today in my home country, which is India, right? So I've learned through a lot of traveling, and finally in Canada, I've learned that there is a way to be able to define for ourselves our role in this pyramid. I have this video that I'd like you to look at. I'm not going to play it now for copyright reasons, but I will be sending that through Dr. Karthik's route for you to have a look at it. You just need to, or you can even just type pharmacy in Canada. Maybe some of you have already seen that on YouTube. Just type pharmacy in Canada and you will get this screen. Make sure you go through that. This will give you an idea of what it is like to be a pharmacist in Canada. So when you do that, you kind of understand our role as clinical pharmacists, right? You're preparing for the health professional world. This is a sheet that I was following. I did my training as a pharmacist in this College of Pharmacy. If you look at those lists, these are the ways that they are expecting us, like how we are expected to be with the society here in Canada. We are held responsible for the resource that we give out to patients, to doctors, to other health professionals, to the society. And we'll be held accountable for doing that in the ways that have been listed out here. So we are advocates. We are stewards of this profession, right? So we need to present ourselves an ambassador of this profession in every single moment of our professional life. So this is the other video that I'd like you to see. I will again send this through Dr. Karthik's route of sharing links. Again, for copyright reasons, I don't want to be playing this because this is not my work, but it is very effective to be able to understand how we are supposed to be rolling out ourselves in the society. So now to be able to do these actions in Canada, there is a board. We call it the Pharmacy Examining Board of Canada. Okay, I'm moving to the second part of the presentation, which is preparation. Okay, so the background is finished. Now I'm going to preparation. So the preparation is based on what the Pharmacy Examining Board of Canada would like you to do. Just to give you a bit of a snapshot, these are the things that they expect you to do, and these are the things that they are going to be assessing you on. These are the ways how you will be practicing your profession of pharmacy. And in a way, this is how you'll be tested in the exam in different ways. Let's go to let's go to the exams that we have here for preparing, right? Before any exam, you will be asked to represent your documents to evaluate. They will assess based on if you're eligible to be writing these exams, which I believe everyone would be because they have a degree in pharmacy. Minimum will be a bachelor's of pharmacy. And most of us are also having a Pharm.D degree. So you would definitely be eligible. It's just that you have to present it to them the way they expect you to be doing it. So mind you, when you plan for these exams, it's important that you understand how do you prepare for these exams, plus how do you plan for these exams. Like, for example, document evaluation. Before you submit your document evaluation, I would recommend you to look into what are they asking you in evaluating exam. Go to their website, the same website that I told you, the PEBC, the Pharmacy Examining Board of Canada, right? Again, my approach to this is always get the information from the right resource. Don't ask another pharmacist to get you the information. Don't ask, you can ask me because I'm here to guide. But just letting you know, if you want to go directly, you are more than welcome to go there and look up the information. When you do that, you need to plan how and when are you going to be appearing for the exam, because once your documents have been sent to evaluate, it doesn't take them long for sending you the email saying that you are eligible to write the exams, please go ahead. But it does have a deadline on it. They do ask you to do these exams in a certain period of time. So when you do your document evaluation, make sure you go through so that you are able to plan. Now, this is where I'm able to guide students in evaluating exam. Multiple choice is the second exam. Observed structured clinical is the practical exam. And these three exams, the evaluating, the multiple choice exam, and the observed structured clinical exam, are the three exams that are going to give you a certificate of qualification from the Pharmacy Examining Board of Canada. Now, evaluating, just to give you a little bit of an idea, it's actually assessing your degree. You have presented your degree, but this is the exam that's actually going to see if your degree had the information that the degree Canadian students are provided. And they are going to assess you based on right from year one of pharmacy to even sometimes they're going to be assessing you based on your intermediate education. They do go back that far. Multiple choice is going to be your clinical theory exam. it is an exam that is going to make you very much realize what pharmacy is. When I was studying, I was told this by one of my seniors, that when you sit for this exam, you will know what pharmacy is. It's a very competitive exam. Your pass rate is based on percentile. So even if you get a good score, like you get those, like basically you get, let's say 80 out of 100 questions right. But in those 20 that you've not got right, if those 20 questions other students have got it correctly, then your percentile drops. And that results in a fail result, not a pass result. So it is an exam wherein you have to make sure that the easy questions have to be you don't have a choice to make a mistake in that. And these questions, both in evaluating and multiple choice, every question is given less than a minute based on the number of questions and the number of hours given to write these exams or to appear for these exams. You have about less than a minute to be able to write or complete these exams. So please be aware, time management is going to be something that you would definitely need to be up to speed for. And this is actually going to be able to give you, an idea of what is expected in real-time practice. You will not have a lot of time to solve cases during a real-time situation, like in real practice situations. So similarly, they're going to be assessing you on that, right? The last exam here that I have listed out to get your certificate of qualification is your observed structured clinical exam. Now, at the end of this session, I'll be doing a case. In that case, you will be realizing what I mean by the observed structural clinical exam. They will be giving you 7 minutes. And in those 7 minutes, you have to perform whatever is being expected of you. And it will be the application of the theoretical exam that you've done before that in a practical setting. So it's the same exam as multiple choice, but now they're going to see how you've approached that answer. In the multiple choice, they are not going to be able to assess how your thought process worked. They are assuming that when you get the right answer, your thought process was right. But in the observed structural clinical exam, they're going to observe your thought process. They're going to look at how you arrived to that answer. And that's where they are going to observe your structure of your clinical knowledge, right? So I'm going to go to the next slide. So once you get this certificate of qualification, you are having, this is the next set of exams that this is the next set of hurdles that you need to be doing. I would, coin this or put the heading on this as a provincial steps. Provincial meaning this is the states, like how in India we have states. Here we call them provinces. So these are the provincial requirements. So IELTS is a provincial requirement, not a qualification requirement. Now, why is that? Because Pharmacy Examining Board of Canada expects you to have that language of command in English, because you have presented that your degree has been done in the English language. However, the provinces are not going to assume that. They're going to check on your standard of English, and for which the IELTS exam is one of the exams that they consider. I am able to, again, guide students in this, because more than English, I feel when I was preparing for this exam, this is an exam that has a technique to solve it's more than the language. Language is definitely there, but along with the language, there is a technique to solve this exam. And then this is something that not just for the English exam, but I would say in the multiple choice questions, in the observed structured clinical questions, and in the evaluating questions, there's a very high level of English that is being used, a very high level of English. Again, there is a technique to solve those questions. Those techniques are really going to help you. You're not reading a storybook when you read those questions. You're not reading a novel or a newspaper just to keep going on and reading and reading. There's a very objective reading that's happening in these exams because, as I said, you have less than a minute to be able to do that. So then after you do this IELTS, you will be able to register yourself as a pharmacy student or an intern, depending upon which province you are going to be in. And some of them are having bridging programs as a mandatory requirement to be able to get to the structured practical training, which is also known as internship. Now, what province or which province is actually going to be deciding whether you are mandated to be doing these programs and which are recommended to be doing these programs? What is going to decide? Some provinces expect you to pass your exams in the first attempt. If you do not pass your exams in the first attempt, then they feel that these bridging programs are mandatory. Now, when you say first attempt, this question should come to us. How many attempts do we have? Do we just keep doing attempts till we strike gold? Do we take the risk without the right preparation? I don't think so. That's advisable. Each attempt is a lifeline. Everybody knows about Kaun Banega Crorepati, right? Everybody is aware of that particular type of game that is being played on TV. There is a lifeline in that. Once you use your lifeline, you can't use that again. So each attempt here is a lifeline, right? So when you have these lifelines, you need to, that's the reason why there is a lot of planning involved in attempting these exams. And again, going back to the first few slides, there's a mental planning, there's social planning, there's financial planning, and then there's this planning about preparing for the exams. So all of this is going to prevent you from ending up getting those bridging programs mandatory for yourself. Why? Because these programs are expensive. They're mandating it to you at your own expense. It's not something that you will be getting, at free of cost. So you want to prevent that from happening to expedite your process of being licensed. Once you finish that stage of your exams, you will be advised to, with those regulatory authorities in the provinces, to find yourself a structured practical training session, which is usually between 6 months to a year. Some provinces have it for 6 months, some provinces have it for a year. Again, you have to decide which province you're going to be. Again, that guidance can be given through connecting with me. But as I said, I can only give you information that I feel is relevant to your goal, which is, in my case, my guidance is going to be just to help you get to the point that you are given the license to practice pharmacy in Canada. However, if that is suitable to you and your goals, is something beyond my scope. That is something that you would be able to decide for yourself. I'm sure you all are professionals capable of doing what is expected of you. Jurisprudence is the last hurdle in this journey of professional licensing. Jurisprudence is something that you would be adhering to the laws of that province, and they will be testing you before they give you the permission to practice. Now, all of this is, how much time do you think it will take for us to achieve these steps along with these steps? I would say it's minimum of 2 to 3 years, minimum, I'm saying, right? It all depends on how finances are available to your discretion. It all depends on how your social stigma is able to adapt to those new surroundings, etc., etc. So what would you think this would require? 2 to 3 years is a good amount of time. It's about 36 months. And if you don't have your focus, if you don't have your, your let's say direction, you may end up making that from 2 to 3 years to 4 to 5 years, right? Because these exams are given twice in a year. It's not more than at this point, at least. So here's the thing. All of this, when you plan it, you are planning for the end goal. So what is the end goal? To be a licensed, registered pharmacist in Canada, right? How will you be allowed to wear this white coat in Canada? By getting this license, by getting registered on the register for those provinces. Now, so when you talk about the preparation, I've talked about a few things about preparation. We need to talk about how these exams are structured, right? These are all about preparation. Now, planning. Planning is going to be based on those 4 topics we have here: biomedical sciences, pharmaceutical sciences, pharmacy practice sciences, and the last but not least, behavioral, social, and administrative sciences. So these sciences are biomedical, pharmaceutical, and behavioral, social, and administrative. I would say the first 2 are very much theoretical. These are some things that you will be reading on your own a lot. They are very much something. These are some things that very much are going to be tested based on your degree, the education you acquired, the knowledge you acquired during your mainstream degree, and sometimes even the intermediate education that you had in the grade 11 and 12. So I'm pretty sure you all are much more well versed with those than I am. Because when I was preparing for this, I was actually supposed to really brush up my basics, which is what this exam is all about. But you see how much percentage they're going to assess you on. 15% of the questions in the exam are going to be biomedical. 25% are going to be pharmaceutical, which is more of pharmaceutics that we have in India, and something along those lines. Medicinal chemistry, I would say those are the questions that come up in that section of 25%. But the big chunk is pharmacy practice. They're going to really grind us on assessing how do you practice pharmacy. And that is 50% of the exam. Now, just keep in mind, even though that is the biggest chunk, in evaluating exam, they are expected that you are going to be doing good in each of these modules, not just the one module, right? In the first exam. And then when you go to the second exam, really speaking, it's 100% pharmacy practice. It's 100% with some percentage given to pharmaceutical sciences. But that is going to be your big chunk, the pharmacy practice. And definitely when you go to the last one, which is the observed structured clinical exam, it's going to be 100%, 200% pharmacy practice. So you need to understand that where you need to focus on. So as Samiksha mentioned earlier, I have realized that there's a lot of interest for people who want to come to Canada, and there's a lot of interest for people who want to become pharmacists here in Canada. However, the questions are numerous. So again, I would say if I'm guiding anyone in this journey, I would be focusing on pharmacy practice, because that's where we really need to be practicing on. That's where we really need to be having a little bit more of a vision on. So before I go into a few more things about this, let me just talk about a little bit about planning the path to Canada. So you want to do all this. You want to prepare for the exams. You want to prepare for the timing of the exams, the financial requirements of these exams. But eventually, you also need to know how to do these exams. I have realized that these exams are now available online because of the pandemic. So make sure you are able to use this to your benefit, and get that information again from the Pharmacy Examining Board of Canada, not through me. And that information is very useful, I think, if you are able to do this online. So what am I going to be helping in terms of once you get those exams, for example, but you're not here in Canada, so what's the use, right? So I'm going to talk about a little bit about some routes to Canada very quickly. I'm not going to be talking too much about this, but I can tell you that I can connect you to the right people if required, if you come to that stage, and I can guide you to tell you, because all of these people I've been dealing with for quite some time. So there's two routes. One is a skilled worker benchmark, which is the basically the immigration visa, and there's one route which is the express entry visa, right? So the skilled worker benchmark, I would recommend all Pharm.Ds to consider this route, because this brings you to Canada in a very strong visa, which is the permanent resident of Canada visa, which is also known as the immigrant visa. The why I say that, because all of you are very young, and I'm sure you're all, in a way, in your own ways, talented. But you just have to try and realize your potential by asking, as I said, asking the right questions. So I need you to understand that there's a benchmark of 67 points. There's a language assessment, there's an education assessment, there's an experience assessment, and there's an age assessment. All of these are giving you points. I'll start with the education part. There is a professional degree option or criteria that gives you an advantage over B Pharms or M Pharms. This is because Pharm.D is a very valuable degree, and that degree is clearly seen on the website saying that it is a profession that requires a license to practice. So that's the reason why you get a lot of points for that. And then you have your IELTS. I would definitely recommend you to do the academic, because that's going to prepare you for the PBC exams, because the level of English that is being used in those exams is top class. For you to be able to comprehend those questions and apply, your academic training for the IELTS is definitely going to be helpful. And try to aim at it minimum, even though for immigration you don't need 7 bands. I think 6.5 or 6 is also fine, but try to aim for 7. Again, this is for the preparation of the exams, not for anything else. This is for your own, preparation. Obviously, everybody has their own level of English. I'm not telling you to spend too much time on that, but if you are able to improve, it's going to go a long way. And finally, the experience part. There is something called a national occupation classification. Pharmacists are in that. They get extra points, brownie points as they call. If you have 2 to 3 years that are matching with your current experience in India, and you're able to match your experience on your resume based on that national occupation classification, then it's definitely going to give you the advantage of getting those points into your application. Now, when I say that, put it, go and check what is that NOC, National Occupation Classification. Wherever you're working, there are some of my contacts that are working already in hospitals. They're working in different organizations. Try to see what they have listed on the National Occupation Classification for pharmacists, and get yourself familiarized with that, so that even though the organization is not allowing you to do that, at least you can start thinking in that way, and at least you are able to implement your knowledge in that way. So to be able to, if at all it is a thing that they are going to be assessing you on during your application, you are able to justify what you've written on your resume, right? And that doesn't mean that it is going to be like, it has to be like 100%. Whatever you achieve from day one is going to be better than what you may achieve in or on day 10, because 10 days experience you've had after implementing that those points in the national occupation classification. I'm going to the express entry section now of this slide. There is a comprehensive ranking system. They score you based on a few things. Again, I'm not an immigration consultant, but what I've known is previously they required at least a minimum of 450 to 500 points. But I've seen recently that they have even allowed people who have got a score of 350 to 400. They are being considered for this application of express entry. Who are the people who are most suitable for that? People who have already arrived here on a student visa, people who are already here on a work permit visa. They are able to get that. Now I'm going to talk about quickly about this work thing after I talk about this slide. So I talked about here about student visa. So coming to Canada on a student visa is definitely a route to do. But you know, the courses that you have after, especially Pharm.Ds, when they do the degree in Doctor of Pharmacy, they end up thinking very high of themselves, which is not wrong, which is very true. You should. But then it doesn't mean that getting a higher degree to Pharm.D is what your route should be to Canada. Because your objective is not to get a higher degree here. Your objective is to have a career in Canada. And so your selection of courses or student platforms have to be objective again. There's no point in you coming and doing a PhD in pharmacy when you're not getting that information about how do you practice pharmacy. So I have listed out a few of my strong suggestions. There's a technician course here that most pharmacy colleges provide. There are many. I don't have. I don't think we should be looking into a lot of them. I would say if you can jot them down to these three here, they're very good value. They are historically being there for a long time. And the last one, the Fleming College, is definitely very much affordable. So I can talk to you about this, again if needed. But then my suggestion to you is to do these courses because of the next few slides that I have. It is a 2-year program, right? Any 2-year program is giving you a 3 years work permit. Again, this all comes in preparing and planning. It gives you a 3-year work permit. So now, why is this work permit important? This work permit is going to help you get into the workforce because that's what's going to help you apply for immigration. Because remember, you are here on a student visa here, which is a temporary visa. The moment your courses end, you don't have anything. You're not supposed to be here. So how do you end up not going back to India? You need some time to work. Right? And why is this critical? Is because you need to plan to be able to appear for these exams. And those 3 years is a good amount of time. What did I say in the beginning? You need about 2 to 3 years to be doing, to be cracking these exams. So that's why this 3 years work permit is very, very important. Now, when you say, what do you do in that? You end up getting an internship. You get a lot of exposure to the culture, the way basically you get a Canadian education, right? This helps you prepare for the exams because you're giving a Canadian exam. Now, what is that is the most attractive thing in this? You're getting hours in your field of practice, which is going to automatically help you earn valuable experience within the national occupation classification. For pharmacists, the number is 3131. That is the code for pharmacists, national occupation classification. It's 3131. So if you go on google.com and you type this number, you will get what is expected of pharmacists for the immigration purposes. So this is going to give you that Canadian experience class, portfolio This portfolio is going to help you apply for that express entry permanent resident visa. All of this is going to take you, so within those 3 years that I talked to you about for the work permit, once you're eligible, you end up getting that processed as of today. This is again from all relevant and government sources. It is going to happen in 2 years' time. So these are the planning that you need. You need to plan these exams if possible, within these time frames. Or there are some students who end up doing these exams after they get their PR based on their, again, their financial, their social, and their preparation levels. Because I don't advise you to be jumping into writing these exams without the proper preparation. What is this going to help you with? These courses are not just to making you feel a little low by telling you that you're going to be going into a course that is called a pharmacist technician course or pharmacy technician course. Trust me, these technicians are very valuable in the workforce. I think my technician, if I'm not having my technician while I'm at work that day, I think I have to work 3 times harder, right? So I really respect the role that they play in my practice. But what is it for you? You are actually going to get the pharmacy education that is required for you to be prepared, because these technicians also go through the Pharmacy Examining Board of Canada. So for them to be licensed, they also have to write these exams, but their own set of exams. But you are going to be trained during these courses in those colleges that I listed out, according to the Pharmacy Examining Board of Canada. It's worth it. It is definitely worth it. And then what do these courses help you with? They help you with placements. They give you internships as a technician this time into pharmacies and hospitals. So if you are one of those Pharm.Ds who like to pursue their career in hospitals, this is definitely one way how you would put your leg into a Canadian hospital. These are the ways that you will be able to get your leg into. Obviously, initially at this stage, you will be entering the hospital as a technician, but you don't need to stop there. You can actually get your license as a pharmacist and just improve your position in those hospitals. It is a way to put your leg in the door. And finally, this helps you engage with the community, because this is something that you will have a lot of, some of them at least will have a lot of issues with adjusting to the society. So some of them, when they have those issues, it's a big hurdle for them. So this is one way of getting used to that. So I'm going to talk about some implementation now. I have a case here to share with everyone. So what we've done, we've set up a background, right? We've understood why people are interested, why people are getting on board to come to Canada. What is the reason why they are interested? What do we need to do to have a good quality of life in Canada? What do we need to do in terms of planning, preparation? But are you going to wait for that to happen? Think about it. It's a long way. You can't think that you'll start thinking like a pharmacist once you reach Canada. It's not the right thought. It is not the thought that's going to give you the success in your goal to be having a career in Canada. Coming to Canada is, as I said, is the beginning of the journey. You can do a lot of other things in Canada, but if you want to be having a career in pharmacy, I suggest you to start thinking about being a pharmacist right from the moment you have the thought about being a pharmacist in Canada. So I have a case here that I'd like to share. I hope everyone can see. Miksha, is it clear for us? Or do you want me to zoom it out?
So can you please zoom it out?
Sure. I'm going to zoom it stage by stage then.
This is good, sir. Yes, sir.
All right, perfect. Thank you. So this Lyme disease is, if
not many of you would know. If you don't know, it is a disease that has happened to people from tick bites, right? So just read through the narrative here. So it's 7 p.m. on a Friday evening, and a pediatric patient's mother is rushing to the pharmacy after being the last appointment for the day at the doctor's office. The mother presents an amoxicillin prescription for a Lyme's disease prophylaxis treatment from a possible tick bite exposure 2 days ago. Mother claims to have successfully removed the tick yesterday. Doctor's office is now closed for the weekend and will reopen Monday 9 a.m. So this is your scenario, right? So anytime you get a question like this, again, I'm going to take you a little bit back to what we discussed earlier about these exams. So now this is a typical question, or this is a typical way they're going to test you on Lyme's disease, for example, in the multiple choice questions. You will have a case and you will be given some information, and that information would be helping you in arriving to the right answer. Now, again, in the multiple choice question, you will not be able to, they are not going to be able to assess how you arrive to that answer. A similar case can be given to you in the observed structural exam, wherein they might give you the exact same case, but they're going to assess how you arrived to the answer, right? So when you have questions like this, you must understand that every single word on this is having a reason why it's there. It's not just they like to write. They're not journalists here, or they're not authors. They are examinators. They're putting in words there. So we need to understand every single part of this. So let's objectively read this, not the way I read earlier. It's 7 p.m. on Friday evening. So what does this mean? It is basically almost the end of day. And it's a pediatric patient's mother. So you're looking at a child here. Is rushing to the pharmacy after being the last appointment, meaning to say she has been working really hard to do what she's trying to do for her child, this mother. And she was the last patient to be seen at that doctor's office. So that means there is a high possibility, which is also clearly stated at the end of the paragraph, that the doctor's office is now closed. So there's a high possibility that now there is no possibility of communicating any questions that you may be having in this situation of discussing with the doctor. So the mother presents an amoxicillin prescription. So right at this point, you should understand that amoxicillin is the drug that you need to recollect on. Everything that you should be knowing about amoxicillin should be in your mind now. And then it comes to the point, what is it for? It is for Lyme's disease prophylaxis. And you also need to understand that it is a prophylaxis. So those are the key words that you need to be picking on. From a possible tick bite exposure, how long before? It was 2 days ago. And then mother claims to have successfully removed the tick yesterday. So again, that is something that may be relevant to help our patient. So these are the things how you objectively would read. Every single point here is relevant. Now, let's go to the prescription. Okay. The prescription here says it's a child who is inside. It gives you a weight, which is saying it was calibrated or basically given 28 months ago. That is as per the records on the doctor's notes. So you need to understand that weight may not be accurate at this stage, because that's been more than 2 years now, right? So it could be that this weight is not accurate. So we need to think about what are the questions we need to ask. We have seen the strength of the amoxicillin prescription that is being given. So that is the strength that is available in the market. And then the doctor has not given you how much to give in mils, but he's given you the dose that he wants you to be giving to this child, and for how long. So these are the important things that you would pick up from the prescription at first glance. And then you will also kind of see where this doctor is coming from. And when there's an information written up there, it's now closed, If you're not aware of the surroundings, then you'll call and ask just to make sure they are not at office, because it's been just not too long ago that this doctor was seeing this patient, right? So based on this, I'm going to give you some time. Now, based on this, I need you to tell me which of the following would be the most appropriate decision to take in the best interest of your patient. Should we dispense the prescription if you think it is appropriate to prevent any worsening of symptoms or the infection? Should we refuse to fill, suggesting prophylaxis treatment is not required? Or are you thinking the dose is not right and the duration is not enough to ensure better outcomes? Or overall, the medication that has been selected is not correct and you want to change the medication, considering the appropriateness of the reason why she's getting it? So I'm going to, if I can give you a few more minutes, if you want to keep looking at this case, because I'm going to change the slide to give you the references, right? So go through it. Let me give you a second. Okay, so the references here are the monograph, which is one of the basically the manufacturer will give you that reference on the available to the public. Lexicomp is another reference that is very useful to be able to understand how to manage such prescriptions, how to tackle such prescriptions, and also Centers for Disease Control and Prevention. Why? Because it is a disease, or it is a disease that can be controlled and prevented through. It's called CDC. It's a US reference. Okay, so I'm going to go to the next slide to talk to you about the reference. So this is from the CPHA monograph. It is giving you a dose, and that says for pediatric patients, and it is giving you information about Lyme's disease, and it is giving you how you're supposed to be using this drug for that indication. Okay, I'm going to have this on the screen for some time. So this is the second reference. It's from Lexicomp, as I said. Now this is how it's typically presented to us when you go and check something, right? How do you go about getting the information that you need from such references? A lot of wordings there, a lot of letters, a lot of numbers, and some are bold, some are font size has changed. So I would just maximize that just so that you can see. It is all the way down here. They have a suggestion for amoxicillin. It can be used in children and infants, and the dose is given in this fashion: 50 milligrams per kilogram per day, and it is divided in doses every 8 hours. Maximum dose you can go is 500 milligrams per dose. As a pharmacist, you should also realize, not just for amoxicillin, but pretty much for most drugs, if at all, at least minimum for the most common drugs, what is the maximum dose you can give each time, and what is the maximum dose you can give in a 24-hour period? You should know that to be able to divide that appropriately, and that is something that should be assessed based on how many days it's going to be given for, right? So that is the important part on this slide, that you need to know that this is the recommendation from one of the references that talk about using amoxicillin in Lyme's disease. Okay. I'm going to leave that for a few minutes. And then I will move to the next slide. I can have that again for everyone if they would like. So this is from the CDC, treatment of erythema migrans, which is what Lyme disease is, basically caused by this organism, or this is how they name it as. And then you need to realize that what are the symptoms of this disease, and what are the recommendations from them in terms of the choices of drugs that are used. Usually when you have a list like that, you need to understand how they are listing out the information that they have listed out. When they have something bolded, that like they have in adults doxycycline, it's usually giving you an indication that this is what you want, you should be focusing on, right? There's a reason why they are bolding it, right? So let's just have this for a few minutes, for a few moments on the screen. Okay, so I can take you back again, just a few more, just so that you get that time on the case again. So just read through those options that you've been given, A, B, C, and D. All right. So I don't think I'll be having the chance to allow everyone to participate, but I'd like you to send in your answers on the chat, just so that you are given the opportunity to answer. And I'd like you to base your answers with this slide that I had shared with you earlier. So you're collecting information from the information that has been given to you. You're assessing that information that has been given to you. You're going to plan your thought process with this information that has been provided. And eventually, you're going to take a decision in implementing the information that has been gathered. And then you're also going to follow up, monitor, and evaluate. This is how the PBC is going to be assessing us, right? So we want to make sure that this is how we are getting into the habit of looking at every single prescription that you get in your practice or in your life, basically, as pharmacists, right? Again, there's another thing that you need to understand about collecting, assessing, and planning, which is the information from the case, that you're going to be using that in a way that's going to help you. There's information that's going to be irrelevant versus relevant. So you have to be objective when you go through those cases. And another thing I'd like to add here is, like, let's just say for the multiple choice questions, this is how the case is going to be given. The references that you see here, this part is not going to be there, because it is not an exam that's, this is not an exam that's going to be having references. This is a closed book exam, the multiple choice questions. So what does it mean? You are expected to know this. You are expected to know this. And you're expected to know this, right? This is how they don't want you, although they are not putting a lot of burden on you to see how your thought process is going. they're not going to assess you on your thought process in the multiple choice, because they are expecting to use your knowledge, your memory in resolving this case. Whereas in the observed structure examination, these references will be given. So at that point or in that exam, you're not going to be assessed about your memory. You're not going to be assessed for your knowledge, but they are going to assess how you arrive to that answer and how do you present your answer to that patient, and how do you end up deciding what you would like to do in the scenario that's being presented to you, and what are the references that you're doing and why that you're using and why you are using those references. So this is what they'll assess you on. Okay, so now these are the things that, as I said, will be assessed. Now let me see if anyone can send me their answers. Samiksha, can you just have that
Yes.
registered at your end?
C, and even my answer is C.
Okay, so C, D. Is anybody choosing A and B?
Not yet, sir.
Nobody. Okay. Thank you. I'm going to give a few more minutes, or let's say a few more seconds. How much time do I have? Okay, so I'll give you a few more minutes because I think we have some time. Okay, so I'm going to continue with the case now. Any additional answers, Samiksha? Sorry.
No, sir, it's C and
Or
probably
D.
D. That's it.
Okay, thank you. So let's just go back to the case. Just quickly, let's go through this case. When you see the disease, Lyme's disease, we just need to have a little bit of knowledge on Lyme's disease, because everything will not be given here, right? So now let's, for example, start to talk about Lyme's disease. The risk of Lyme's disease, okay, from a tick bite, even in an area that's highly possible or highly endemic, rather, the right word is highly endemic, is low. Okay, first and foremost, it's very difficult to get Lyme's disease from a tick bite. However, what is the percentage of people actually getting affected? According to one reference that I have read in my reading, it is approximately 3%. Now, what are the chances then for this child suffering from a Lyme's disease? Very minimal. What makes me say that? If the tick is engorged, the risk is different. If the tick is flat, if that means that's a different. So that is a different risk. What do you mean by engorged, and what do you mean by flat? It basically means, engorged means the tick is actually into the body, not on the body. Okay, engorged means the tick is into the body, whereas if it is flat, means it is on the body, not yet in the body. What does the tick want to do? It wants to suck on us. It basically it gets into your body to get your blood. So if the tick is flat when removed, we have information here that the mother claims to have successfully removed the tick yesterday, but she doesn't know since when the tick is there. The only way you will get that information out from this mother is by asking the right questions. By asking the right questions, meaning, what makes you think the child had an when did you think that the child was exposed to this? When did you see it? So she would say, yesterday. The moment I saw it, I removed it. But then you'll ask, do you know what had happened? Were you in the woods? Did you go to the forest? Were you on a trek? Etc. And then she'll give you information. Yes, 2 days ago we were in the woods, we were camping, and that's probably where she got it. So those are the information that you will gather from your interview with your patient. So the risk of exposure to tick Lyme's disease is much lower when the tick has been found flat, because once it's engorged, it's basically going to be there for a while, right? So when you saw that the tick was flat, that means it has not, possibly there's a high chance that the tick was not engorged. The consensus on post-exposure prophylaxis for Lyme disease is that there may be some benefit when the tick is engorged, meaning it is beneficial to start a prophylaxis therapy for a situation when you have noticed that the tick is engorged, or you did actually see the tick inside in the body. So now here's the thing, right? So we don't know what exactly is happening, but what has exactly happened. But what we now know is the doctors assessed furthermore and decided to go ahead with this amoxicillin prescription for this child. Now, assessing this is something that you would, now here's where you stop thinking about Lyme's disease and you move on to the treatment, now the prescription. Some experts say prophylaxis can be started within 72 hours of removing a tick, even if it has been attached for more than 36 hours. So these are the information that you should have in your knowledge. Prophylaxis can be started within 72 hours of removing a tick. So in this case, the tick was removed yesterday. So let's say a minimum of 24 hours, but a maximum of 36 hours. So it's definitely within this range. And if it has been attached for how long? For more than 36 hours, then there is a benefit of initiating prophylaxis treatment. This is the information that you should have in terms of your knowledge with Lyme's disease from a tick. As the infection is extremely low, like for example, if the attachment was there for less than 36 hours, he's saying 2 days ago, there's a possibility that it was just 24, 48 hours. But then there's a possibility that it could be more than that. So prophylaxis in situations wherein your assessment is coming up to say that the attachment was there for less than 36 hours, then the doctor would have not even gone ahead and presented this or initiated this prescription. So now here's the thing to decide, yes, it is required because it's been more than 36 hours, highly possible that it's more than 36 hours. So the first thing about should we dispense the prescription is definitely true, right? But
Yes.
moving to the part wherein now as a pharmacist, you are assessing if this is the right dose now for this patient. So B is totally out of the question, refuse to fill, suggesting prophylaxis treatment is not required. That's what it means here. However, now the thing about adjusting the amoxicillin dose and duration is where we are at now. Is this appropriate based on the references we have? It doesn't look like it, right? It said that 50 milligrams per kilogram per day on the reference that we have here, and also in this reference. So, and then, but it also says divided in every 8 hours and for 14 days, 14 to 21 days. So again, this one doesn't say that. So we have an issue here. We have the right to treat. We have a prescription to treat, but it's not the appropriate dose or duration. So there is a possibility that the outcomes will be not as expected or not what we want it to be. Then the question comes about whether we change the dose and the duration, adjust it, and then accordingly we take the consent of the patient and or the patient's mom rather in this case, and then we basically go ahead and do it. However, the other thing about this is the first choice in another reference that we had is the CDC recommends doxycycline as the first choice. However, it's a child here we are talking about, not an adult. So this makes us understand that possibly doxycycline may not be the first choice for a child. Now, overall, this is how you would arrive, but then you should also understand that the doctor is now closed for the weekend, so you don't have an option to do any decision here because the doctor's office is closed now. So you take the consent of the patient's mother to be able to decide how she would like to go ahead with it and how she would like to proceed with this situation. So there's other things that we can ask to be understanding how to be able to help us, right? Now, if you decide to refuse to fill because it's a young child, you don't want her to be given a medication that's going to just end up making her resistant to that antibiotic by giving her just one dose at that dose. And you also don't want the child to end up suffering from Lyme's disease. So as a pharmacist, you would take this opportunity to explain to the mother that for patients who do not take prophylaxis, right, an acceptable alternative is observation of the tick bite site and the development of a rash that can happen as the situation worsens. Because you have information about the mother found the child not having the tick engorged into the body. It is basically flat. So that information is also relevant to be able to decide. However, you don't just assume that in your head. You would communicate that to the mother in this case, or to the patient if it was an adult. And you would continue to observe if there is any rash that's getting bigger in size. And it should also be remembered that Lyme's disease is less often resulting from a recognized tick bite, since the removal of the tick within 2 to 3 days of attachment usually prevents the transmission of this disease. Right? So now the mother said that you were there in the woods 2 days ago. So that's 48 hours today. Yes, day before yesterday. Yesterday, and she removed it yesterday, right? And then now she's here. So it's about 48 to 72 hours where all of this has happened. So you would kind of go on those lines to tell the mother that although it's a good idea to initiate treatment, however, there's two options in this. One is I adapt the dose of amoxil to what my reference says. Remember the word I'm using here, adapt. So I'm not going to be changing anything here, except the dose and the duration, just to make sure that it is not something that is treated incompletely. And then you will inform the mother about this. But then if the mother says that, no, I trust my doctor in what he's done, and I am not comfortable in you changing my child's dose, then as a pharmacist, you should respect that autonomy. We call it autonomy. That is the patient's decision to accept treatment or reject treatment. And if the mother, which in most situations it's not the case, here in Canada they really trust us when we give information out like this. However, it depends on how much confidence this mother has with the doctor that she's visiting. So we would tell her, if in case you are not comfortable, I am with you on that as well. However, I would like you to keep an eye on the rash. If it progresses into a situation that's worsening, then I would expect you to be going back and getting a second assessment done. So this is how so the answer for me really would be, if I'm allowed to do it, I would do C. If I'm not allowed to do it, I would choose B. It all depends on, like in the exam, the best answer would probably be either C or B. Now, more information would have been provided for the sake of the PBC to be able to come down to that single. You cannot choose two answers, right, in one question. So my thing would be, in this case, if I would have given information on the case that's kind of hinting towards C more, then the answer would have been C. If I would have given another set of information that's more relevant to B, then my answer would have been B. But we would not just dispense the prescription as is, and we would not consider moving the prescription from amoxicillin to doxycycline. Hopefully that is giving you a little bit of understanding of how you're supposed to be thinking and how you're supposed to be approaching to a case. So as Samiksha mentioned in the beginning of, like when she introduced me, I am helping some of my contacts in reviewing topics, in reviewing cases like this for different topics. So we are having a good session once in a week to be able to do those on a regular basis. Karthik can also, guide you in that if you are interested to know more. But these are the ways that you should be preparing yourself. You don't need to wait for coming to Canada for this. You're all pharmacists, as far as I know. Even if you are in your degree period, you have to start preparing. The more earlier you start thinking in this way, the more sooner you will be more competent to be able to practice confidently for your community, wherever you are, not necessarily in Canada. Now, coming to the most important question, why are we doing all this? We are doing this for having a good quality of life, right? We are not just doing this. I mean, obviously, we are doing this. We entered into pharmacy to be able to do something in the healthcare industry, but we are also doing this because we want to have a good quality of life. So let's go to the slide with how much do pharmacists make in Canada, right? These are some resources that I have to show. So there's one resource called Glassdoor, which is very much, authentic. That's about all in Canadian dollars. So 102,000 Canadian dollars in a year. There's another website that says approximately the same, right? $100,000 a year. And another website that says, these people are a little bit more conservative. They gave you only 90 here. So in short, it's about $90,000 to $100,000 a year. Is it good? It's good.
Yes,
Trust
sir.
me, it's good. It's good. It's not like but you need to understand, I mean, this is something that you should also be aware of, that we pay taxes in this country. And if you're in this bracket, you pay about $25,000 to $35,000 of that in taxes. So it comes down to about, I would say, in hand, you get about 65 to 75,000, depending upon how your circumstances are in terms of your personal background. Like if you're married, if you have kids, all of that is going to be changing in terms of how much you get back in your pocket. Now, I can talk to people more about this, right? But what I need you to also understand is, what if you are able to get pay these kind of salaries in India? It's going to be amazing, right? It's going to be really amazing if the society is able to give you this kind of pay in India, which I believe it's a long way to go. But I think in my recent visit and in my recent visit to Hyderabad, which is my hometown, I say that the potential of doing this in India is immense. It's just unbelievable. Especially COVID has opened up the doors for this, I think. I know a group of students who did a lot of social and free of charge service to help people in their time of need when we were going through the second wave in India. Okay, these were obviously at a free of cost because it was a humanitarian issue, not a business issue, right? But in order for anyone like those students and like those individuals in the profession to continue to be able to do those kind of services and to keep them intact, we need to make a system. We need to make a way that these students or these professionals in the pharmacy industry are not just doing this as a humanitarian, but also it's something that are going to give them that quality of life that they are intending to have at some point in their career. Because I'm telling you, every pharmacy graduate from India may or may not be able to reach Canada. All of us are not having the destiny is what I call, right? Everybody's not destined for Canada, even though I think this conversation today is about Canada. But I'd like you all to think, what is the possibility in having this kind of levels of practice in India? I can't do it on my own. Dr. Karthik cannot do it on his own shoulders. And I think Dr. Karthik has been doing a tremendous job and that's probably the reason why I connected with him, because I really value the way he's doing this for pharmacy, profession of pharmacy. So we can't do it individually. We have to do it as a society. What is the society we are talking about? The Pharmacy Society of India. So I have a way. I feel that I have Dr. Karthik's passion with like-minded professionals' passion that we have today. I'm sure all of you attending today's session are also passionate about doing something or giving back something to the profession at some point in your careers. That's why you're here, not just for Canada, but also for where you are right now. So there is a way to do it, and I have a way that I think is going to work, for which this is not the session for that, but there is a way to do this for the Indian platform or the Indian market. And you are more than welcome to connect with me. But then again, it's all not going to happen overnight. It is a process, and that process is going to happen only with people like us, like-minded people like us, eventually getting on board to this journey, right? So if anyone is interested, they can connect either through Dr. Karthik or to myself through this email of mine. But yeah, that's I'm just going to stop now, and I'll just leave some few minutes for any questions. So make sure you can moderate that, how many questions you are able to allow. But yeah, I think thank you very much for attending, and I really look forward to any questions that you may have for me.
So Alvin, whoever is monitoring YouTube, you can put email ID and ask them to send any questions. Okay, so put in the chat, or even in the video description we can have a email ID where they can write those questions. So Ashraf ji, thank you so much. I really enjoyed your presentation, the clarity, the honesty with which you shared all this information. And last 5 minutes was my favorite. So everybody is not destined to have a career in Canada, and there is a huge opportunity to provide that kind of service in India also. And I'm happy that you already have some plan in your mind. So all I can tell is I'm definitely passionate. I will support, and as you said, we can collaborate and do it. And right now, I can share actually. A couple of days back, I connected with an company which is serving patients across the globe. They have around 62,000 patients on their platform. And I happened to connect with him for some reason, some random reason. But that discussion turned entirely in some other direction. So now he wants to create a profile for a clinical pharmacist on his platform who will be addressing all the issues regarding medications of the patients who are already on their platform. Like they have patients across the globe. So it is just the question of
Nice.
competency and potential of students if they want to take this up and start. So I will talk to you in detail later. So
Nice.
yeah, so Alvin, you can put the email ID or whoever is moderating the YouTube. So anybody in this group, if you have a question, I think we will take one question, and you can always reach out. Like we will be available. And I want to stress that Ashraf ji is already training few students free of cost, spending a lot of time and helping them. So he has that nature. So if you are really sincere to make a career in Canada, even if not, as I said, all the knowledge we should definitely learn, whether you go abroad or you stay back. So we will be happy to support and guide. So anybody, one question if you have, you can ask.
Hello, hi sir. Myself Kishan sir.
Hi.
Hello,
Hi,
Ashraf sir.
Kishan.
Myself Kishan Labana. Myself Kishan Labana sir. I am from Rajasthan. I am pursuing Doctor Pharmacy. Right now I am in third year sir. Sir, my question is that sir, what are the mistakes that you have made during this journey of Canada, and you would suggest young aspirants of PEBC to not commit that difficult and problems that we will not commit. What are the problems and what are the difficulties that you would suggest us, sir?
Okay. Thank you very much for that question. I think it was a very important question, what Kishan has just mentioned. I think the biggest mistake that anyone would do in this journey of acquiring uh, this qualification would be listening to pessimistic people or getting affected by people who discourage you by saying that this is a hard exam or this is a very long process. It's not practical. It's not easy to achieve. I believe stop listening to those people. Okay, just stop listening to them. I lost, I think, like when I came to Canada, I came with my first baby that is expected, and there was a lot of pessimism around me that this is not worth it. It's not going to give you the quality of life that you are hoping for because there's a lot of competition. There's a lot of, the exams have been becoming very tough. It will take a lot of your time. Your social life is going to be affected. And so it's not really worth for the money that you're going for, which is in the end a quality of life that we are all trying to achieve. However, I tell you that this information that came to my ears did kind of take me away from this preparation for approximately 6 to 8 months. It did. And I lost those 6 to 8 months in this process. It was just so happened that one of my personal experiences at work made me realize that this is not going to be what I would like to do. This is not the way I would like to pursue in the future. So it had taken me, I would say, some time. But again, I'm not saying that what the person or the pessimism was around was incorrect. It's not incorrect. It was true. What was true? It is a hard exam. It is going to take a lot of your social life out of your picture. It is going to cost a lot of your possibly health. But you all are young. You all are going to be going through stress anyways. you're going to be going through a lot of deadlines anyways, right? Whether you take this step of becoming a pharmacist in Canada, or whether you take this step of becoming a successful pharmacist in India, there's no work in this world which is stress free, right? I think everybody is having their own part, but where you want to be, as I said, you need to be planning your next 5 years, and that's what you need to be doing. If in case you think that this is very hard, it is hard. It is not possible, it is possible. If it is something that cannot be achieved, it is achievable. But it all depends on how you take it. If you take it in the right way, it can be achieved. I was told when I was here that Canada exam is the most toughest exam compared to the US and the UK, and for some parts, somebody told me even in Australia. It's not wrong. It is true. These people really. I have pharmacists that come from the US and are moving to Canada for various reasons. They find that the Canadian exam was much tougher because they were already pharmacists in the US. So again, it depends on what stage of their life they got that exam done. But on a very broad perspective, it is a tougher exam than the US exam, the NAPLEX. It is very much they have a very high standard of expectation, not just till you get the PBC qualification, even after the PBC qualification. The provincial authorities that I told you, they assess our pharmacists every single day. They are very tough. When they give you that license, they are not just going to be forgetting you. They are going to be looking at how you're maintaining that standard of patient care. So it's not just once you get the PBC, that's it. No, it is going to be definitely monitored. And they do that by sending you random assessments. They pick you randomly based on the practice that you are currently showing that you are doing, and they pick on us. And so far they've been, from what I know, they've been very transparent, and they tell you why we have been picked up, and they tell you why we feel that this is good for you. In the end, it is all for the public that they say, which is true. The public puts a lot of trust in us when we are out there helping them, and that is the trust that they want to maintain. The College of Pharmacy maintains by assessing their members, pharmacists basically, and pharmacy technicians. So yeah, so good question. Don't let anyone discourage you. It is not easy, but it is possible.
Yeah, so actually we have few more questions. What I will do is I will send it on your WhatsApp. You can ask me.
Sorry, sir, but one more question from my side,
Wait,
sir.
wait, wait, wait. You already asked a question, so we should respect speaker's time also. So you can type and send those questions because we already have like 6 or 7 questions in the chat box. So Ashraf ji, I think I will forward those questions. We can answer and maybe put it on LinkedIn or share with those students individually. Any feedback from any student, I will collect and share it. But here, if somebody wants to share your feedback, what you felt, you can do.
Yeah, sure. I mean, I think I'm not like we can do that, Karthik. So I'm getting like if I can, I'm not sure if I can access those questions after the session has ended.
Yeah, I will share. So Samiksha, you can copy those questions and keep with you. Means you don't have to do anything. I will forward.
Yes.
Yeah. So anybody wants to share your feedback? What did you feel? Nagaratna, you can unmute and speak, or anyone.
Hello, good afternoon.
Yeah,
Hi, good afternoon.
Yeah, hello, sir. It was like a very nice and very knowledgeable session, sir. Like it gave me the all the clarity Like I am like my future plans are to like go and crack PEBC. So this session gave me like a good clarity, like what steps should I focus and where should I concentrate more. So thank you so much for this session, sir.
You're welcome. You're very welcome.
Yeah, Ashrafji, and on behalf of all the students, thank you so much for taking your time. And I could see how much effort might have gone into making those slides and constantly exchanging uh, and communicating with me for last 2 or 3 weeks. So I really appreciate that. And yeah, thank you so much. And rest of the feedbacks I'll collect and share it with you.
You're very welcome. You're very welcome.
You can start the YouTube stream. And yeah, so let's keep in touch. Maybe we will have a pool of really interested students and think about doing something here in India as well.
Yeah, that is the final goal, I think, that I have in mind. Because things that are not nobody's doing